It's past
And I don't quite
12:30 and we have a quorum, so I'm going to call the meeting to order.
Puts all these houses in the
First item is approval of minutes, and so because we moved our meeting up by 2 weeks, no one has received the minutes before, so we want to take a minute to quickly review them.
Mr. Broker just emailed me, said he'll be at the meeting in 3 minutes. It's approximately a minute
Well,
ago.
that'll give us time to finish reviewing.
He must be coming directly from neighborhood.
We're reviewing the minutes. they found a correction or? So one capitalization need to be made. I think that's pretty much.
Evil eye.
So is there a motion to approve the minutes?
I'll make a motion to approve the minutes.
Second?
Second.
Okay, all in favor?
Aye.
Opposed? Okay, the minutes are approved. Dr. Jetmore will not be here today, and I will comment that very shortly we'll be having being able to immunize with the booster for the COVID vaccine. I've read some things very interesting about it. This vaccine, apparently they think will actually be a better match for the viruses that are mutating out there currently. Apparently they call them the flirt variants, and they've all kind of mutated to kind of the same way of effectivity. So they think this new vaccine will be better matched than previous. But having said that, it probably still will only be good for a matter of months. Because they've also, what I've read is that this is the fastest mutating respiratory virus they've ever seen, which is not good news.
That's not good.
But what the good news is that with the population being exposed to it, and several people having had it, plus with the vaccines, we've really reduced the amount of hospitalization and death. But it's still very important for the vulnerable to get the vaccine and to consider the oral treatments that are available if you come down with COVID, like Paxlovid. There's another one that if you're in a high-risk group and you come down, that you still strongly should consider taking those medications.
I think I would merely just appreciate if they chose a different term when you reference flirt variants.
Yeah.
This is something I'd rather not flirt with. They define it. It was like when they named hurricane, just
Right.
something different. Flirt variants. Yeah. But thank you, Dr. Wright. That's great.
Okay, go on to director's report.
Health First Indiana updates. There's really no new updates from the last time we met a week and a half ago. I did have some meetings this morning with HFI representatives from the state, and we're moving forward as we should at this point. The financial report, nothing's really changed with the budgets in the last week and a half either. The immunization grant is with the Department of Health, and we should be receiving our purchase order number and everything within a week. The safety pin grant has officially been dissolved with the State Department of Health. We can reapply when the time comes, or we can apply for new funds if they come available in the future. The staffing updates. I do want to start with the director's position.
Okay, and I'll take it from there. Basically, the board acting as the personnel committee met an executive session. We reviewed the applicants. There were 4 applications received. We felt that 2 were qualified for interview. We interviewed 2 people, and the consensus was that we should recommend that Dan Burke be appointed director of the department. So at this point, we need a motion that we're recommending to the commissioners that Dan Burke be director of the Wayne County Health Department.
So moved.
I'll second.
All in favor?
Aye.
Opposed? Okay, so recommending Dan, which I hope will be a formality. But that, I think, will happen tomorrow.
Appreciate the confidence.
Congratulations.
Congratulations.
Yeah.
So moving on, next we're going to the Virgins agreement. This is a staffing company out of Indianapolis that potentially could provide us with medical personnel. It's in the hands of the county attorney at this point. Virgin's attorney reached out to me because we asked him for a more detailed contract, and he's reaching out to me and attorney Ron Cross, and hopefully we'll have a meeting here real shortly, and we can define those terms and get this contract moving forward so we can get some staff in the building. FEMA position, the full-time position was filled with the part-time employee, Cynthia Blue, so she was moved from the part-time position into the full-time position. She's a good fit. State Department of Health, the conversation I had with them today, are excited to have her on board as a full-time representative for Wayne County Health Department. And with saying that, we have a interview set for Thursday to interview the part-time FEMA position. We had interviews last Wednesday to fulfill our part-time clerk position. One of the 3 candidates was offered a conditional offer for employment through our HR department. She did accept, and she starts her process next Monday. Program updates. SSP has been completely moved to Centerstone, and to my knowledge, it's moving pretty smooth over there. We've actually increased the participation, I believe, by moving it to Centerstone. Not by much, but some. Miscellaneous. Vaccine series started for 2 individuals for rabies. These were 2 juvenile individuals. After I'd already typed this, we had another 2 adults. One started the series, the other one wanted to start the series. With that said, I'm going to ask the board to entertain a policy on the rabies vaccine series. So the first shot is very expensive, and we can't afford to retain it. It doesn't have a shelf life but of maybe 6 months. So I'm going to let Crystal, our public health nurse, better explain that in medical terminology maybe, better than I can. And after that, we'll discuss the policy.
When someone is either post-exposure to rabies, you have to have the immunoglobulin injected, and that's based off weight of the patient. Which the HyperRab, it comes in 5 ml bottles, 1 ml bottles, and 3 ml bottles. The 3 mls tend to be obsolete because you don't use them as often as the 5 and the 1. The 5 ml bottle is $47.28.99. That's just for 5 mls. I did examples for dosing. For someone who is 165 pounds, they would need 1 of those. For someone 200 pounds, they would need 1 5 ml bottle plus 2 of the 1 ml bottles. The 1 ml bottle is $945.80. With that being said, for these patients, total example for patient 1, that's if we're not charging our price, if we're just off the shelf doing everything plus their 4 vaccines. Patient 1, $5,704.97. Patient 2, that's a 200-pound person, they're $8,570.55.
And this is a 1 series
This
injection.
is a 1 series injection. This is for, say someone gets attacked by that and they have an abrasion or they have actual, a wound that needs to be
Puncture
taken
wounds
care
some
of.
sort. Mm-hmm.
They automatically have to have the HRIG, which is the immunoglobulin. And for them to get that, you have to inject directly into the wound. And then you have to do a series of 4 injections of the Rabivert.
Mm-hmm.
With my thought process, and I have these printed out if anybody wants one, when you do the first dose, there's a lot more to it. You have to have certain syringes, you have to have specific needles, and then, you have to have saline, different types of medical supplies that you would need for like more of a trauma-based appointment. And we don't have that, and we're not necessarily a trauma-based center or an office. That would be more suited at like an emergency room or an urgent care. With that being said, for the 2 people that we're now doing 4 people, they have gone to the emergency department for the first round of vaccines. They're coming to us for the remainder. We have, those vaccines are $487.99, which is pharmacy price. Insurance price is $585.59, And then they can also pay cash if they want to, which, I mean, again, these are very high numbers for these kinds of, issues that we're running into. I mean, there is a higher bath population I've seen this year, but you have to have, for these to be covered by insurance, from my understanding, you have to have someone do a visit. You have to have a physician sign off that you were seen for post-exposure. Insurance will not touch it if it's pre-exposure. And I just, Dan and I have talked again. I think it would be a decent policy to put into place that they need to be seen at like an emergency department or, either that or an urgent care, just to determine where to go and what is necessarily needed.
So my proposal is that we draft a policy that states, in situations like this, the patient responds to Reed Hospital for their first dose. That's the $4,800 dose, and obviously more. There's not too many people in today's world that's 165 pounds, so we're going to be spending a lot more money on this first dose. To keep it on the shelf, it's going to cost us that $5,000 to $7,000, and it only has a shelf life of about 6 months. So we're going to constantly renew it, because we only get 1 to 2 of these cases a year. So my suggestion is to draft that policy that states they respond to emergency care, urgent care, or the primary care physician first for the first dose, and we as a health department can then do all doses afterwards. What's it called, the Rabivort?
Yeah, Hyperrab is the immunoglobulin, and then Rabivert is the follow-up shots.
And those follow-up shots are $485 a piece, and usually the series is 4 additional shots on top of the original shot.
You get the Rabivert with the Hyperrab, which is dose 1.
Dose 1.
And then you have one that's on day 3, day 7, and then day 14.
So three doses, and they have a shelf life of approximately 3 years. So we can keep several of those on hand, and we can definitely serve the public in that fashion. We just don't have the funds and the space and storage to pay that much money and just let it expire in 6 months. There's a lot of what ifs, and this, we kind of hit a snowball effect here. This is the season for bats over the next couple months, but we typically don't get this very often at all. So I just
the
don't
other
think
thing
it's...
is that the emergency room then has a physician order to complete the rest of the series, which you need. So I think it makes sense on a lot of levels.
Would this be a new policy? Is there already a policy in
There's
place?
not a policy, not on the local level. So if I've got the board's permission to start drafting that policy, we'll get on that as soon as we can.
Draft the policy and then just bring it to us.
Yeah, that's to me. All right. Crystal, is there anything else you'd like to add?
No objection to how the policy was generally outlined.
Yeah, sounds good.
Dr. Wright, you want to flirt with that?
No, sir. That's another one I'd rather not flirt with.
Yes. Oh, hey.
Rabies, COVID,
Bats.
some of my siblings, no, I don't want to flirt with them. No.
So that's all I have for miscellaneous. We'll move on to environmental. No updates with food, lead, or housing. It's status quo in those 3 programs. And the public and pools and spas, we did have to shut down 1 public pool for an unsatisfactory water sample. Since that closure, they have corrected the issue, and it is back open. We're currently investigating 2 failed septic systems that are discharging onto bare ground. Animal bite situation, we just discussed that with the bat case. Vector control, we're encouraging the public to drain abandoned pools, cover exposed tires, and remove stagnant water sources. And the tattoo and eyelash extensions, which is new with the HFI funding, we're still working on the procedures, getting close to completion on that. They're in the hands of a local tattoo artist that agreed to be an advisor for us. And once he reviews them and gets back with us, then we'll present those to the board as well. And That's all I have, sir.
Any old business? Again, anybody who knows someone who might be interested in being the county health officer, let me know. I'm making inquiries. Hopefully we'll have something in place soon. New business? Comments from the public? Dan and I spoke, and we don't feel like we need to have a meeting on the 17th. So that our next meeting would be October 15th. So, I entertain a motion to adjourn.
So moved.
Second.
Second.
All in favor? Opposed? Thank you, everyone.